Have you ever gotten a medical test result that felt, well, more like a riddle than an answer? Today, we're putting on our detective hats to crack a case that a lot of people face, a diagnosis that sounds really confusing and, let's be honest, kind of scary. Indefinite for neoplasm.
So let's set the scene. You've gone through a stomach endoscopy. They took a tiny piece of tissue, a biopsy, just to be safe. You're waiting for a clear thumbs up or thumbs down, but instead, you get a report that just leaves you scratching your head. When the evidence is that murky, what do you do now? Well, that riddle has a name. It's indefinite for neoplasia. Basically, this is the official term that pathologists uses when they look at your cells under a microscope and just can't make a final call. They can't say for sure if the cells are harmless or if they're precancerous or something more serious. It's a true gray area, a diagnostic puzzle that means both you and your doctor need to find more clues.
Okay, so how does this even happen? I mean, why isn't it just a simple yes or no? To figure that out, we have to rewind and look at how the evidence was collected in the first place. You'll see pretty quickly why it can be so unclear.
Think of a forceps biopsy like a detective grabbing a tiny pinch of soil from a giant crime scene. For starters, that sample is just a teeny tiny fraction of the whole suspicious spot. Then you've got inflammation. Simple inflammation can make normal healing cells look really weird, kind of like an innocent bystander who just happens to look like the main suspect. Plus, you have to wonder, did the biopsy even grab the most important part? A millimeter to the left or right could make all the difference. And to top it off, some cancers are just plain sneaky. They spread under the surface, making them incredibly difficult to catch with a sample scraped from the top.
This is where the first detective on the scene, your gastroenterologist, plays an absolutely critical role. Long before any lab results are back, they're already gathering visual clues during the endoscopy itself. They are looking for those telltale signs that shout high risk or whisper, probably nothing to worry about.
And here's what the doctor is seeing through their scope. Now, to you and me, that might just look like a slightly off-colored patch of tissue. But to a trained gastroenterologist, that flat lesion is a major clue. It's not a blaring siren, but it's more than enough for them to say, okay, we need to take a much closer look at this. The visual case is already being built.
And this isn't just a gut feeling. They have a system. They're looking for specific risk factors. Is the spot bigger than a centimeter? That raises a red flag. Is it really red? That could point to some funky cellular changes. What if it's sunken in or depressed? That's another warning sign, because some cancers grow inward. And if it bleeds with just a light touch, that tells the doctor the tissue is fragile and abnormal. The more of these boxes that get checked, the higher the suspicion level goes.
All right, the visual inspection is done. The sample is taken. Now, that little piece of tissue heads off to the forensics lab. This is where the pathologists take over, putting it under the microscope to decode what's really going on with these cells. In the lab, this whole mystery often boils down to telling two main suspects apart. First, you have regenerative atypia. Think of this one as the look-alike. It's caused by normal things like inflammation or healing, where our cells are just growing back really fast. They look a little weird, but they're harmless. On the other side, you have atypical epithelium. This is the prime suspect. Here, the entire structure of the tissue is getting twisted and distorted. This is a much, much higher risk for being precancerous or even full-blown cancer.
But here's the problem. Telling these two apart can be incredibly tough. That's why we get that indefinite diagnosis in the first place. So, how do pathologists get more certainty? Well, it turns out there's a brilliantly simple clue hidden right inside the cell itself.
It's a technique called assessing the four lines. It's amazing, really. In a healthy, happy stomach cell, you can trace four distinct parallel lines. Right at the very top is the protective mucus cap. That's line 1. Just below that is the base of the cap, line 2. Then you have the main part of the cell, its body, which is line 3. And at the very bottom, you've got the nucleus, making up line 4. It's this beautiful, orderly 4-layer system. And here it is, the aha moment. Look at the image on the left. That's a healthy cell. See how you can trace those 4 lines? The mucus, its base, the cell body, and the nucleus, all stacked up perfectly. Now, look at the image on the right. This is a precancerous cell. The 4-line structure is completely gone. It's chaos. The nuclei are all over the place. The cell bodies are warped. This loss of order is the smoking gun pathologists are looking for.
So, with all the evidence in hand, from the endoscope at the crime scene and the 4 lines test in the forensics lab, we can finally solve this case. What do these indefinite lesions actually turn out to be most of the time? Well, a big study from 2021 looked at almost 500 of these cases and gave us the breakdown. The good news is that most of the time, a little over 60%, it turns out to be a non-neoplasm, which is just a fancy way of saying it's benign, probably just some inflammation. Phew. But, and this is a really important but, look at the rest of the chart. About 11% are precancerous, and a pretty significant 28% are ultimately diagnosed as cancer.
So what's the big takeaway here? It's simple. While the odds are in your favor, you cannot afford to ignore this diagnosis. If you add up the cancer and the precancer numbers, you get almost 40%. Nearly 40% of these indefinite cases are something that needs to be taken care of. And that right there is why follow-up isn't just a suggestion. It's absolutely essential. So what does that follow-up actually look like? Well, there are usually three main paths forward. The most common one is just surveillance, coming back in about 3 to 6 months for another look and another biopsy to see if anything's changed. Now, if those visual clues we talked about suggest a higher risk, your doctor might just decide to remove the whole lesion right then and there with the endoscope. That gets rid of the problem and gives the lab the whole thing to analyze. And in the rare case that advanced cancer is found, then more serious treatment like surgery might be on the table.
So in the end, this whole medical detective story really shows us how doctors work to turn uncertainty into a clear plan of action. They piece together all the clues, the big picture from the endoscope, the tiny details from the microscope to solve the puzzle. And the 4 lines technique is just a perfect example of that. It really makes you wonder, doesn't it? What other elegant hidden clues are just waiting to be discovered inside our own selves?